Picture a little girl awakened from her sleep, coughing, wheezing. She musters the energy to get to her parents' bedroom. Mommy, Daddy, I can't breathe. The family gets dressed, and to the emergency room they go. Imagine this happening almost every night of April and October for the first 10 years of her life. Imagine her inhaler, crucial as a limb, always by her side, next to her bed, in her school backpack, a constant companion. And then she gets bombarded with strange claims that, asthma medication can be very addictive. Exercise? That's terrible for someone like you. Fast forward. That girl now stands before you, a doctor. Not just a medical professional, living proof that these myths are baseless. Well, I just ran 2 miles this morning in Washington Park, my inhaler untouched. These aren't mere misunderstandings. They are a signal of a deeper problem, a widespread epidemic of poor health literacy, threatening our society. I want to show you the human side of this problem on our journey together tonight. How false beliefs, myths, and misinformation can seriously hurt people that believe them. Can you imagine if asthmatics really thought they couldn't exercise? Exercise is something that's very important in general health. Most asthmatics, well-managed asthmatics, can actually exercise. It's very important. I want to take you back to that little girl. Fortunately, I have been able to manage my asthma. I have not taken daily medications in about 6 years, and I have not visited the ER in about 30 plus years. But this wasn't due to chance or aging. It was because of my amazing allergy and asthma specialists. They taught me the first most important thing, what exactly I was allergic to that was causing me to have asthma attacks. And so then I knew to avoid all of my asthma triggers. It is so important that we understand what is going on with our health. Health literacy is a terrible, terrible problem in this country today, and it's costing us more than just ER visits and medical expenses. It's costing us our lives. Tonight, let's take a journey on this life-changing experience and find out how we can get better literate on our health so that we can have a healthier community. We make a stronger and healthier community by first exchanging reliable information, dispelling myths, and encouraging one another on our health-related journeys. Let me give you an example. During the COVID-19 pandemic, Black people heard this crazy bad information that they were resistant to COVID-19 virus. By the way, that was wrong and fatal. And the statistics showed 60% of COVID-19 fatalities here in Chicago were among Black people, but we only make up 30% of the population. The Guardian showed us these numbers in 2020, and this was an alarming information to find out that this much false information caused this much death. What can we do to move our society from being one that believes in health realities instead of all these health myths? How do we avoid this problem? Health education materials for everyone. according to the U.S. Department of Health and Human Services, the average adult is 36% of adults in America are at basic or below basic health literacy levels. So what does that mean? It means that all the materials need to be easy to understand and be visually appealing to all walks of life. So what do? You make sure that you use simple language, make sure all the materials are translated in several languages, and as I said, make sure that the videos or whatever images are visually appealing to all walks of life. Digital resources. It is so important in this day and age that we use our digital resources for telehealth as well as mobile health apps. Did you know that there are 318,000 mobile health apps between the Google App Play Store and the Apple App Store? So why not use them? There's many people who, for whatever reason, cannot leave their homes, but if we use digital resources, they have access to physicians and they can get recommendations, reminders, and consultations, all from the comfort of their home. This is probably one of my favorites. Use social media. 80% of American internet users seek health information online. That's it right there. Social media is a great place to get health awareness and education. Between Facebook, TikTok, and Instagram, we can use social media for health campaigns, to alert us about any coming health crises, hopefully no more, and we can also debunk health myths. Another great thing about social media is it's a great place where we can bring patients, medical professionals, and the caregivers together, and they can hopefully form a support system. Partner with community organizations. The organizations that work within a community are the best organizations to talk to because they know the community. The health groups that come in can talk to them and find out exactly what the needs are of the community, and then they can also help them to tailor, through feedback and insights, they can tailor the information so that it fits to work and make sure that the most people are going to get the information to the right place and they'll understand it. This is the final one. Evaluate the effectiveness of health education programs. Now, this is very important. You have to assess all of the health care initiatives. Now, I'm not talking about finding out how many clicks went to a website or how many pamphlets were distributed. No, all those fun, wonderful evaluations we fill out, we need to fill out those evaluations so that they can understand, have people change their attitudes, has their knowledge increased, do they know more about health? And then we also need to make certain that going forward, we have evidence-based information and we have best practices. We can create a healthier community. We just have to put these actions into play. And when we do that, we will tackle health literacy head on. And we will get people educated on their health and they can make more informed decisions about their health. So, I love the fact that health literacy is getting better, and I want to share with you a very special story that will help you to understand why this is so important to me and to you, hopefully. So, remember that little girl? Imagine that little girl, short, desperate breaths, a fight inside of her chest for every inhale. That was me countless nights. I was fighting an enemy that I had never even seen and didn't even know how to spell, but the word was asthma. But there was a bit of a wonderful beacon that helped me in this whole process. It was my mother. My mother is a respiratory therapist. My mom went to work every day and she would come home and she would tell me amazing stories about the people that she saved at work and what she saw at work. She was the first TikTok doctor. And if you don't know, on TikTok, a lot of medical professionals are giving out short bits of health information. My mom would come and give me that information. But it wasn't like bedtime tales. My mother was teaching me lessons of compassion, resilience, and advocacy. She was demystifying my condition for me every day. She was helping me to take fear to understanding and isolation to empathy. My mom was the one that taught me how to see the human being behind the patient and how to see the symptoms, to see the symptoms behind this person behind this, the patient behind the symptoms. My mom, my health advocate, breathed life not just into my lungs, but into my purpose. She is the reason I stand before you today. So, one night, unfortunately, I did actually stop breathing. And thankfully, my mother, the respiratory therapist, performed CPR as my dad drove us to the emergency room. Now, I just wonder how many people heard that story, and parents especially, and went off and took CPR classes, because that happened when I was 3 years old. So we can, I know you all are like, what can we do? What can we do collectively to make certain that we are all ready to get ready, to know what to do for our families and friends when they have health situations? So, the first thing we need to do is we need to be discerning consumers of information. Meaning, everyone has a platform nowadays, but you need to make sure that you look at the source before you digest any information that you see. Because misinformation can spread faster than a disease, and it can cause panic, confusion, and false hope. Next, find yourself a health advocate. In my journey, I was lucky, of course. My journey, my mother was my health advocate. But yours could be a trusted physician, a knowledgeable friend, or even a community leader. And this will be the person that navigates you through the health world of information and will help you distinguish between fact or fiction. And lastly, every one of you is a health advocate, a health storyteller. You all have a story to tell. You just have to start telling it. You don't need a large platform, and you don't need a medical degree. Just start with your circle. Sharing your story, sharing empathy, and personal experiences. And you never know. You could be like my mom and be a beacon of hope and decide, and you could be the one that helps somebody else out. So in closing, I want all of you to think about who has helped you to navigate health or make you understand health, your health. And then think about who is the unsung hero in your mind that took you through that fog of health, of the health system. And then think about, if we were all those people, that same person, how many people could we help if we all were beacons? So let us all be a light like my mother and others like her, and let us shine a light through the pathway of health literacy so that we can stop letting health literacy be a privilege and actually a right for everyone. Your voice, your story, just might save someone's life. Thank you.